Hello, hello, hello. Hello, happy Tuesday, the last Tuesday of the year 2021. We'll go into 2022 soon. So, how was your Christmas? How was the holiday? How was meeting with the family? A lot of people met with family members and friends and all that too, and people are coming down with COVID and cold symptoms and all. So, if you're having any of these issues, please reach out to your doctor, and if you need to get tested, so you get tested, okay? Um, First, before I do this, because I'm always forgetting, and I'm just gonna share this to my other page. I have to find a way to do this before I come on, but apparently I can't, so I have to figure it out eventually. But just give me 2 seconds there, and I will do this. Just a little bit of housekeeping. Um, Go in there. Sometimes my phone is not coordinated with my computer there, so it takes a little while to get to where I need to get to. So I'm going to go in here, and I'm going to go and put this in my group. Okay. 1 second, sorry. And post. For those of you asking, every time I say that, I have another my group, the same Abby Tyler's Healthy Living. I've been doing that group since 2014. This is our 7th year now. So I just started this page a couple of months ago. So I still have people in that group, and I still maintain both groups. So I'm just gonna do that, and then maybe share to another page there. Always seems like whenever I come on here, that's when I have the sniffles. Anyways. Okay. So this is where we are. I'm gonna lower this for a little bit. Okay, so happy Tuesday again, and the year in review and the month in review are finishing up this year. We got into this year with COVID, and we're going out with COVID. Except this time around, we have the medications, we have the vaccines, we have different medications. They even came out with the tablet form now. Hopefully, that can be out soon so people can use that. And but you still have to get vaccinated because you want to prevent it. The medication is to treat it after you get sick. So we talk about prevention, and then we talk about treatment. So if it's out there, go ahead and get it done. I wish you always just speak to your doctors and people who, not people you find, the doctors would be the person to speak to your providers and get this vaccination, because we have to get out of this thing. It's going on 2 years now, and it's getting old. We are all getting tired of it. Okay, healthcare professionals, the ones that are in the hospital setting, acute care setting, I feel for you. I was there last year, and it's like sometimes it's just too much. I still have, like I say, I always tell people, I say I have anxiety and depression sometimes from everything that we went through. And I was there during the first and second wave, and then summer wave, and I think it was two waves. So please God, just be out there. If they tell you to kind of watch where you're not supposed to be out there with too many people and people who are not vaccinated, and don't go on there. Don't hang out with, stay out of big group if you have to. If you can get away from that, you can put your mask on, wash your hands frequently, and just do everything else. And those of you who don't want to get vaccinated, just do everything that you can do to keep yourself healthy and keep your family members healthy too, because you don't know their medical history, and you don't want to put them at risk. Even those who are vaccinated at the same time too, you can still pass it on so bad at the same time. That's why you still have to follow the rules. Wear your mask if you have to, or as much as you can. Stay healthy. You want to eat healthy, exercise, stay active, because if God forbid, if you get sick, you want to make sure your immune system is strong enough to fight it. So, and people who heal from it, people forget about that. You heal from it, and there's something called long haulers, long COVID, where people having dizziness, fogginess, sore throat for months and months and months, difficulty be able to like concentrate and think. That goes on for a long time. So you want to make sure it's not just you get sick. Oh, I get sick, and even if you're really sickly, you still suffer from the long-term symptoms. You may. So please go out there and get the vaccine, or at least do something to keep yourself healthy. Okay, do as much as you can to keep yourself healthy. As always, my disclaimer, whatever I say here, you want to make sure you speak to your provider first before going on and changing any medical regimen. Sorry, I got distracted a little bit. So just make sure you do that. And like I said, there, everything. Don't change any medications. Don't change anything. So if you have any questions, go to your provider and ask and say, yeah, I heard this, and I just wanted to make sure. Okay, so let me start. formal introduction. My name is Abby Tyler. I am a professional, I'm a family nurse practitioner. I practice in private practice in Philadelphia. And prior to that, I was a registered nurse for 22 years and I worked in the cardiac floor. So that's me right now. I would say this at the beginning of every place. So, and also people are saying they're changing things. The CDC changed things from last year, and they're changing things, and they're just going about doing whatever they want to do, or just making things up as they go along. I mean, pretty much this, this virus was new to us last year. So a lot of things that it was being learned along the way as new information come forth, and the research is ongoing every day, every day, every day. So if they find something different, they're going to come out and they're going to give new recommendations and all that. So sometimes some of the recommendations may sound like, okay, how do they expect us to do this? Like they're saying healthcare professionals can go back now after a certain time, a shorter period of time. I mean, sometimes I want to, as a healthcare professional, you sit there, be like, that's not fair. And we're doing everything to keep ourselves safe and keep our patients safe. At the same time, also you go back and say, well, when things become known, when they find new information, they're going to bring it forward. It's the same way when you were in a hospital and you had surgery. Back in the day, you had surgery and you lay in the bed for like a week or so. All we did was just move you around and don't bother the person. The person just had surgery, and new information came about and saying when somebody has surgery and you keep them in bed, I mean, there's a higher chance of like their lungs not breathing properly, so they could get pneumonia, they could have blood clots, and also most of the time now, as soon as you get out, you have surgery and it's safe enough for you to get out of bed. Next morning, physical therapy and occupational therapy is like staring you right in the eye to get you out of bed. And we started processing even with having babies and everything else that has changed over time. Some of the changes that, were going on with this COVID, it may not be pleasant to us, but we just have to do our best. So just hang in there, and hopefully eventually we'll be out of this in no time soon. Okay, I will be able to live with it in a way where it won't be disrupting our lives and livelihood all the time. Okay, so that is my spiel for my COVID guidelines. So now I'm going into the year in review. Okay, so mainly I'm just going to go on saying that I do have a group also, like I said, and this year I've talked about so many different things. So at your leisure, whenever you have the time, I have a video on breast cancer, diabetes, domestic violence. I talked about what to expect when you go to your doctor's office. I had a show on what kind of questions they're going to be asking you, so you know how to respond to those questions. I put a lot of different posts onto different things, and the medication part. We did a lot about COVID also. I did mention part of men's health and women's health, but we kind of incorporated in different videos. So, but I did put some other posts out and all that. So some of them are below this post that I'm speaking on, and then also those who are in my group is in there. So I'm gonna try to kind of re-event there next year, not re-event, but try to talk more about them. So it's gonna be on this forum, and it's also gonna be on my group as well. So, but I'm not going to make this long. It's already 8 into that. I always say that. I don't want to make long videos anymore. So, here it is now. So so when you have the time, just go back and read that and just watch that. And if you have any questions, you can always just comment under the video. And also if you want to inbox me, you can do that. Okay, so going forward, this is the time of the year when most practitioners start telling the patients what test they want to be looking for next year. Okay, the following year, everybody's going to be doing their lifestyle change. I call it lifestyle change. You can call it New Year's resolution. You can call it whatever it is you want to call it. Whatever it is you want to call it that way. And don't let anybody tease you or discourage you from doing that, because they might say, oh, every year you decide you're going to do this, and then turns out you don't do it. So whatever it is you want to call it there, and then go on from there. If it means you're not going to change anything because you're already awesome, that's even better. But my thing when it comes to healthcare, there are much more we could be doing. So looking for next year, always these testing. I'm going to go into age group. You want to make sure that you having your physical every year. You're supposed to be having annual physicals. For those who are in age 20, I'm going to put my glasses off for a second. Okay, excuse me. If you're age 20 years old, for in your 20s and all that, you want to make sure you're getting your physicals. In addition to this is going to go on for every decade. Do your physical. You do your annual physical where your doctor does the complete, your provider does the complete physical, and they're right for blood work. Women, if you're age 21 and above, it's time for you to start getting your annual pap smear, or according to how often your doctor wants you to get it. It's also age 20, in your 20s and 30s is when you're in your childbearing years, your early childbearing years. These are the years where you want to make sure you're staying healthy, you're eating okay, and also, like I said, go into your GYN so they can make sure everything is okay. So when you do decide to get pregnant during that time, you're going to be healthy for the baby and also have a healthy pregnancy and also a healthy childbirth. So they'll be looking at your numbers, your labs, and all. There's also the time to talk about contraception because you may not want to get pregnant. Also, people take contraception because of difficulty with their menstrual cycles, like very painful, very heavy. So there's many reasons why people take contraception. A lot of also you'll be taking it for birth control purposes. So this is time to talk directly to your GYN about that. Age specific vaccines, like usually in your 20s, by then you'll be done with all your meningitis and everything else. That up to age 19 you would have been done with that. There's still somebody like a flu vaccine, those who are going to work, hepatitis vaccines and all that. If anything that you haven't caught up on, that's the time to do it. Getting your annual flu vaccine, like I said. Go into age 30s, you still want to be doing your physicals, your annual physical, we're doing your annual labs. We're talking about annual labs, I'm talking about your CBC, your complete blood count, where we check for anemia, we check for any kind of clotting factor, any kind of infection, your BMP, we checking for your liver functioning, on the CMP complete, or that functioning, your kidney functioning, your electrolytes, all the chemicals that control your body, making sure your thyroid's okay. We checking for your hepatitis profile. We checking also your A1C to make sure you're not diabetic. Go back to watch my diabetes show and you'll know more about what I said about that. When you get to your age 40, that's when we start doing age 40, 45. We start doing colon cancer screening. We have the one where you just take the company will call you. The one that we do is Cologuard. I'm not endorsing any specific company here, but they send it to you, and you just, if you don't have any family history of colon cancer or no personal history, they send a packet to you. You go in there, you're not going to be touching anything, you pack it up, you send it to them, and as soon as they get it, when it tests the DNA that's in your stool and they check it, and it's like really like 95% accurate, and it's like good. If it's negative, you're good for, you don't have to do it again for 3 years. It's 95 to 99% effective. And if it's positive, they will tell you it's positive, and you have to follow to have a colonoscopy, because usually when it's positive, that means, it doesn't mean that it's positive for colon cancer. It just means that you need to have it just means that you're following up on the deal to make sure there's nothing else is going on, that they need to visualize your colon. Also, women's health at this time for women 45-ish, 40, 45, if you don't have any history of breast cancer in your family, this is when we start doing the breast cancer screening. Some people will say age 40, depending on if you have like a first degree relative that had breast cancer, and whenever that person was diagnosed, they want to tell you try to get it done at least maybe 5 to 10 years prior to. That's also with colon cancer too. That's when you start getting into your 45, 50-ish, that's when you start speaking to your GYN about menopause issues and all that. I told you before that menopause is when you have 12 consecutive months of having no menstrual cycle, and some people can go into early menopause in their 40s, and some people can still be having a menstrual cycle all the way up into the 50s and all. So that's when you want to be talking to your doctor, and they can go on different options on how to treat menopause symptoms and all. When you get to age 50, you want to make sure you continue again. Most of these tests don't stop, after a certain time. You just continue to add on to it. Age 50, you're going to be doing your shingles. For men in their 50s, checking for your PSA level, your prostate levels. Also, I didn't talk about, we'll be talking about men's health later on. But we're checking your prostate, making sure that your numbers are okay. And if they're elevated, they might call you back to say you check on it again and go on from there. Especially if you have family history of prostate issues, you want to make sure you go that. already. They also do lung cancer screening for people who smoke, who are heavy smoker, not heavy smoker, but smoke for a very long time, like 30 years. Now they use like, one time cancer screening. And also you want to be, hopefully you would have been talking to your doctor about quitting the smoking at that time because it's not healthy. Um, at age 60s, when you get into 60s for women, again doing your physical, and you'll still be seeing your GYN for all that. They're doing DEXA scan. If you're a very small frame person, they do the scanning to make sure your bones are strong, so that measures how strong your bones are, and to make sure that when you fall, you're not going to suffer like a major fracture if from a fall, and also because your bones are thin, you're going to fall. So most of the time when they get older, especially if you're small frame and you fall and you break a hip or you break like any major bone in your body, most of the time that always leads to like disability, and sometimes it could even lead to death. Because if you're living at home and you're all by yourself and you fall, or even if people were with you and they went to work and you fell and you're laying on the floor, you could be there for a little while, and as every minute that goes by, the danger and irreparable and damages kind of just add on until it's too late. Or like I said, you could end up completely losing your ability to do things for yourself. You're losing your independence. And most of the time for women, that can become very depressing. So you want to make sure that, and when you get into your 60s, age 65 is when you start looking for, to do the DEXA scan. Also, when you're in your 50s too, as you get to menopause, and after that, you want to make sure, talk to your doctor about putting in some calcium and vitamin D, because your body's not making too many, your bones are not as strong anymore, and you want to get that for supplements. So you want to talk to your doctor about that. Also in your 60s, you want to be getting your pneumonia vaccine. Also continue with the flu vaccine too. And going back to that, all of that, incorporating all of that. So you want to make sure, and if you're smoking, like I said, make sure you stop smoking. Some people say, I smoke, but I don't smoke in front of my kids, or I don't smoke near my family. I don't smoke around my kids. I smoke outside. But you also, we tell people that even if you don't smoke around your children and all that, when the smoking, it stays on your clothes, and that smell is like neurotoxic to a young child's brain. The child's brain is developing as they grow up, and they're smelling your clothes, because people who smoke, it smells on their clothes. I don't care how much you spray it up, it still smells there. So if somebody is like, that young child is in contact with that, continuously, that can have a negative effect on their brain. So you want to make sure that, there's so many ways to stop smoking. You can, there 1-800-QUIT now, 1-800-QUIT now. And when you speak to your provider, they have medications, they have patches, they have so many things that can help you to quit smoking. If you drink, it's important that you also talk to them. They have different services, Alcohol Anonymous, because eventually that's going to lead to liver damage and so many different dangerous lifestyle changes. Because if you're drinking heavily and unruly, you're not gonna be making the most healthy decisions. So you want to make sure that if you have a problem with drinking and you talk to your doctor, that's confidential. You can go ahead and get the help that you need. Okay. And then also, going on to next year, if you doing your lifestyle change again, and like I said, lifestyle change or whatever you want to call it, New Year's resolution, make sure you do designing a realistic plan. Now, it would be nice to say, I look like this today, and by the end of January, I want to be like, top model and this and that. It's okay. Nothing wrong with that. But I know very well that it's safe to only lose at least 2.5 pounds a week. So I'm not going to sit there and go do something and starve myself, or do over exercise too much to where I probably hurt myself and not drinking enough to be dehydrated, just to have unrealistic goals. So make sure you have realistic goals. If it means writing it down and going and join a gym or do exercise plan, you don't necessarily have to join a gym. You can go ahead and do an exercise plan. You can partner up with somebody, but just remember, when you do partner up with somebody, make sure that you're the stronger partner. Because if you're the person who they have to encourage so much and the other person has to be encouraged so much to go, then you both will end up not going. So you want to make sure you say, I'm going to keep myself accountable. I'll keep you accountable, but I want to keep myself accountable as well. So make sure you do that this time, and don't go joining no expensive gym, because you'll be all gung-ho and going January and February, and then next thing you know, you may not go again, and you're still paying that money. Especially pay attention to the fine prints on the contracts. So I'm not endorsing anybody, but I usually go to Planet Fitness. It's like $10 a month. I haven't gone there forever. I've been donating, so I have to stop using my money's worth. And so you go there, at least they don't have the same as much as the other ones, but they have enough. So if you want to start off doing that and you say, okay, eventually I might go to the other ones that have more, then fine. Or you can stay there because I think they'll be revamping their place and all. So it's like $10 a month. You go there once or twice or 3 times a week and get your exercise on and get fit. Okay, they say, you want to look good outside, but you also want to look good inside, because when you have a healthy weight, that also translates to less stress on your bones, less fat and everything that's going to cover your blood cells that would, cause you to have type 2 diabetes later on. Also, all of that, your heart's working heavier if you have an unhealthy weight. Notice I say unhealthy weight, not saying fat people or skinny people. I say healthy weight. Okay, it's a BMI scale that you can go on. Yeah, you can look on and see, but sometimes it's not realistic too, because it was like made so long ago. It doesn't take into account so many different factors that affect somebody's weight. So go ahead and do that in 30 minutes a day or more, and 3 times a week. Try to do that. Eat healthy, eat healthy, eat healthy. Eat more fruits and vegetables. Try to eat some salad because it has the rough fish and it has the fiber that's going to get all that gunk out of your body. Brown rice. And always when we talk about going to the doctors, we always, people don't, not to forget, but sometimes they don't include your dental care and your vision care. So you want to make sure that you're seeing your doctor, your eye doctor, every year, as recommended, to get your eyes checked, even though you might say, I have nothing going on with my eyes right now, I'm fine, I can see okay. Doesn't matter. There are many other things that can be found through your eye examination, so you want to make sure you get that checked. And if you have health insurance, you're paying for it anyway, so why not use it? And also your dentist. You want to see your dentist twice a year for cleaning. The dentist will look to make sure your gums are okay. They're going to look down your throat to make sure there's no growth in your throat. Look at your tongue, make sure there's no cancer growing on there. So it is not just, and also they find so many things when you go see the dentist. So at least twice a year, get your teeth clean and make sure you're flossing every night. And I already talked about the video part. So at your leisure, please go back and watch those videos. And like I said, it's the last Tuesday, so I don't want to be too heavy. And topics I would like to cover next year, I want to talk more about pediatrics. People say I don't talk that much about pediatrics. Most of my patients, I take care of, all my patients that I take care of now are 18 and above, but I am trained to take care of from infants to death. So I'll talk more. I'll do more topics on pediatrics next year. My sister-in-law is a pediatric a nurse practitioner. She's more like neurology. She's more into specialty, but hopefully I can get her on here and we can talk, or I can consult with her so she can tell me more current stuff, because I'm not taking care of children right now, but I do have that training. I am going to talk about women's health. I'm going to talk about men's health. There's so many different parts of women's health and men's health. I'll do some elderly care. I'll talk about kidney disease. Will also touch on many topics, the current topics, as the year goes on. And also, we'll be talking about issues concerning healthcare in Liberia. So for those of you who are Liberians, I'll be talking about that. For those of you who aren't Liberians, please join and watch too, and you may learn something, because from what we have learned from COVID, we live in a global community now. So you can say that's happening over there, this is happening over there, but all it does, it just takes one person coming from, you can be here today in Iowa today, and the next day you're in another place in another country way across the world, and whatever they have there, you bring it here, and whatever you have here, you can take it there. So the world is so closed now, it's so formed. So you want to make sure that just listen and just learn. Okay. And I think that's pretty much it. I've been talking for about 22 minutes now. So I just want to thank you all again. Thank you so much again for coming along this, joining with me. For those of you who are new, who started with me on the page, I say thank you. Those who are in the group and those other forums, I say thank you. I'm going to come back on New Year's Day, but I will be posting in between now and New Year's Day. But until we see again, take care of yourself, take care of each other. Like I said, COVID is still hanging around. Please be careful out there. If you have any pre-existing conditions that makes you at a higher risk, I'd say higher. I didn't say the other ones like have no risk, but just make sure you're taking care of yourself. And people would say, oh yeah, well, this person, everybody goes to the hospital and they say it's COVID, and this person died from COVID, this person had other diseases. I said, if you had asthma and you were in a car accident, you died from the car accident. You didn't die from asthma. So when people say, oh no, they just say everything is COVID. No, it's not. No, that's not how people are diagnosed. So if I forgot anything, I would just kind of add it to the bottom there. And so guys, thank you all. For those of you who are watching now, I say thank you. For those of you who will be watching later, I say thank you. And take care of yourself, take care of each other. Please, please, please reach out for those who are having a rough time right now. Things, you know, a lot of people go into a lot of grief. I myself was going through stuff, and it took me a little while to get over this Christmas stuff. So it was hard this year for me to do that. So I can just imagine the family members who are like directly involved. So call, check on somebody. If it means texting, you can text them. I'm the kind of person, if I'm going through stuff, if you call me, I probably won't answer unless if I absolutely know you. I would probably just text you back and say, I don't want to talk right now. I may text you back and forth. So text in whatever way you want to reach the person, even if you think the person's fine, even if you think the person's going, you'd be like, I'm just calling to say hi to you. You know, how you doing? We haven't talked for a while. How you doing? Everything's well. The kids are okay. Okay, I'm just making sure everyone, and just reaching out. Okay, because people can be fine today, and this year has been like so, you know, so you could be fine today, and you'll be like, oh my God, this person was just at my party. This person was just, I just saw this person here. I just saw this person there, and that's just how things are going nowadays. I mean, it's been going like that, but it just seemed this year has just been too much. Okay, so reach out to everybody, the ones who are suffering, the ones who are happy. And sometimes people can be completely happy and they have so much going on with them, and they just mean that one person to pick up the phone and say, how you doing? Okay, so I wish you all the best for the rest of this year that we still have. Today's the 28th. So we have like what, 4 more days. So just take care of yourself and be careful out there. New Year's Eve night into New Year's Day. If you don't have to go out, don't go out, because you know people be driving drunk, and also you want to make sure you stay safe. And if anybody's driving drunk where you are, you at a party, make sure you tell them, you know, I'll take your keys from you, okay, and keep safe. And for those of you who have family members or friends who don't like to be on Facebook, I also have a YouTube page. Please go there and like the page and subscribe to it, because whenever I'm done here, I usually take these videos and just put it up on there too. Okay, so thank you for watching. It's been 25 minutes. I said I didn't want to be here that long, but it was important information. So, but in all, I say thank you all so much, and take care. Good luck and good night. God bless.